So, what is the right timeline for the family to seek help from the doctor? So, the early, the better. That's what the
Early
message.
the better.
Yeah.
Yeah,
So, this is the message we should be giving to the parents. The early, the better.
exactly.
Okay.
Early the better. Even the small symptoms has to be addressed.
Yes. So, this is about the child development when if a parent is approaching early. I'm sure even for the family also, it's a good thing if they approach the doctor at the right time because they themselves are
Exactly.
impacted a lot. So, what do you have to say
Exactly.
about it?
See, first is like, I will say the major ownership has to be taken with the pediatrician or the family physician where they are visiting, because it's not only we visit them to the flu and, the cold. They should also have a developmental track in each and every aspect. See, generally
Right.
what we see is like,
Hmm.
somewhere the development gets skipped. They should be having the high risk. They should be under the high risk, and what happens, parents also what they think is like, okay, they will wait for the uh, changes to happen. They
Hmm.
will not approach anyone because they want to keep it under one shell, because they are the social stigma is more.
Yes, absolutely. Yeah. So my next question is about
Yeah,
that only, social stigma, the reaction of society towards ASD, especially the Indian society. I mean, you must have met lots of patients and their parents. It's just not you are just treating them or listening to their doing their therapies. You must have listened to their stories also, how the society, their own families, the associates, friends reacted towards it, and how it impacted them and the child. So
see
tell
I
us
feel
about it.
yeah see I feel the social responsibility for any common man has to be the more awareness, like, has to be
Yes.
created to the social setup, because the acceptance of these kids are very less. Either you take it in the school or you take it in the park. We don't have the or in any common gated environment anywhere, we face all these challenges because they are it takes a larger milestone for the common people to support these people, because these kids, they will have behaviors, or there will be some emotional outburst will be there. We
Hmm.
have to understand that part. So if you know that autism, they have a lot of social challenges. The kids who are falling under the autistic kids have a lot of social challenges. So if the society is groomed to accept right from the schooling, we have to teach them, because as you said,
Yes,
the number of cases are increasing day by day. And
absolutely.
like I have visited many Western countries too. The acceptance in the Western countries is common. Like, you
Common.
can see
Yes,
kids
true.
moving around in the
Yeah.
mall or anywhere. But
Hmm.
here, what happens? People start looking when a child is crying with emotional outbursts. People start like, gathering or looking at them in a very strange way. Just, ignore it and accept them. Call them to a party, call them, or as a neighbors when we are there, call them to their house. So what happens? They get the social adjustments, and especially in the school, what happens? See, what happens? These kids are not, accepted in the play areas.
Mm-hmm.
You
True.
know,
True.
so even in the school, if we are educating the peer group kids, how they have to accept,
Yes.
these challenges can be addressed very easily, and this social stigma can come out. And many parents, what they do, because the social challenges are very high, they isolate themselves
They
from the
isolate
social
the child.
gatherings.
Absolutely.
And not only the child, either mother or father or both, because already they will be undergoing a turmoil in their, as a young parent, they will be
Mm-hmm.
undergoing a lot of emotional stress in bringing up this kid, in having the future into the question. In
Yes.
that, if the social setup is not supporting, especially as a child is growing up in the play area, if the child is not accepted, in the school, if the child is not accepted. So I really encourage all the schools like Western countries should have the inclusive setup, and the
Yes.
special counselors and the educators to be set up, so that these kids are treated among with us.
Yes. True. They are one of us, and one has to
They are
understand
one
that.
of us.
Yes.
And we have to understand, we have to extend our support, and we have to educate our kids who have to grow along with them.
Yeah, that is the whole intent of this podcast, Doctor. More awareness
Exactly.
about it. So, if I talk about the pregnancy time, I just wanted to know how a mother's psychological health during pregnancy is related to autism.
See, though there are not a greater clinical evidences, but we have been witnessing and we have been reading a lot of articles that mothers' emotional stress
Okay.
plays a very important role in the well-being of the fetus, and
Mm-hmm.
which should not affect the developmental aspects.
Mm-hmm.
And also we in our in our clinical exposure, I also witness challenges, or we should have a high risk when a mother is during the gestation period, if she's having hypothyroidism or gestational diabetes,
Okay. Okay.
these are the age factor or the social habits. These are, we have to keep it as a high risk, so we have to keep a clear monitoring. And it has a, when a mother is generally we say during pregnancy we should be happy. This is a normal statement which we say we should keep ourselves very happy, because the fetus should grow very the development should not be affected because of the
True.
emotional stress what the mother is undergoing. So the emotional stress, the anxiety plays a very important role apart from the other well-beings of the mother during the gestation period.
So, yes, mother's mental health is important, though it is not
Very much
directly related
important.
to autism, but it is important.
Exactly. See,
So,
if we can see our older traditional method,
yes.
traditional way in the suburbs and all,
Mm.
they call during pregnancy, we go to relatives' house, or, they come and see us, they give us food. These are the things, small, small things
Small, small
which we
things. Yes.
had traditionally, which,
Yes.
the mother can be happy. And the
Yes.
work related stress,
I
this
think
I
that
see
is
recently.
the key point right now with the current
Exactly.
generation, work related
Mm,
stress and the nuclear family concept. This is something
yeah,
which is actually impacting the psychological
very
health of
much.
the mother. So, in some cases where there is a genetical history in the family, so is there is any kind of a test to recognize autism before the child is born or during the pregnancy?
See, there is no specific test to diagnose. As I told you, this is a
Hmm.
neurodevelopmental disorder.
Yes.
So the maximum development happens between 18 months. That is why it is called a neurodevelopmental disorder. So there is no specific test can be done either during the pregnancy, but keeping in mind with the family history, we can
Okay.
have, so family history, like, any of their family members are
Mm-hmm.
having any other genetical disorders, or, family members
Mm-hmm.
are affected with autism or something, we
Mm-hmm.
can have a genetical test done, and then we can have them in the high risk.
Okay.
So
And
that, once the baby is born, we can have the monitoring of their of the child's development appropriately
okay. And as you said, there is no test to recognize autism after the child
during
is
the
born,
pregnancy. Yes, yes,
during the
yes.
pregnancy
After
or
the
after the.
child, during the pregnancy, but
Okay.
as the child is growing up,
Yeah. Then it's the
every month the
symptoms and
developmental.
signs we go through, and then
Yes,
how we recognize this. There's no specific test
exactly.
for it.
Not test, but at the age of 2 years, we can start with the assessments. Like, there
Okay.
are
Okay.
diagnosis test tools are there. So that
Okay.
is from the 2 months. We call M chart and all are there. So where they will assess the child's developmental aspects, both
Development.
in the see, like, a 2-year-old child. If you ask where is the head, it will point out. Where is mama? It will say. Where is papa? It will say. So
Huh.
like this, there are test tools are there. So
Okay.
we call it as a M chart test tools, which we will be using for the high risk. If we don't call it as a diagnosis, we put them it as a high risk.
So you have been in this field from past 2 decades, doctor. So what kind of a graph are you seeing in the awareness among the parents?
See, awareness among the parents, yes, it has increased a lot. It has increased a lot, but still, why we are having, even though the awareness has increased, why
Hmm.
still the diagnosis has raised? What I started 10 years before
Okay.
is too high now.
Oh, so the
It's
numbers
too
are
high. I
increasing
see
in
the
ASD.
numbers are increasing. Yeah. So
Okay.
that can be the factors. One is, as you said, a nuclear family,
Mm-hmm.
okay, or the social well-being, our mental health, parental mental health,
Yes.
and their style of living. You know,
Mm-hmm.
all these things are creating the more environmental factors which influences the kid more into the spectrum.
Oh,
See, as we are brought up as a child, when we
mhm.
are growing up, we are allowed to play in the mud, or we are allowed to move
Yes.
into our neighbor's house. You are allowed
Mhm.
to interact with, people around in your street. You can play in the clay, all those nowadays, we kids are missing. These kids are missing
Yes,
nowadays, is it?
the parents are becoming very hyper about all these things. No playing in mud, don't play here, don't
Yeah,
do this. I mean, either it is they're overloaded with knowledge and they are missing
exactly.
out the small, small things in that, which is very important for child development.
Exactly. So what happens, though the awareness is coming up, these environmental factors are influencing in any one factors, either ASD or a ADHD or a sensory processing disorder,
Mm,
any one challenges because
yes.
of this can also be one reason.
Next question is again about the latest thing, which is called virtual autism, where increasing screen time in child is connected to ASD in early 3 years. So please tell us more about it, because what I get to understand it's really increasing in India.
See, it's very much increasing in India, and
Mhm.
especially I will say during the period of COVID, the kids who are born during the period of COVID, because the kids were locked inside the home, and they have been exposed more to gadgets or the TV. And here, what happens is, see, you can see when you're going to a restaurant or when you're going to a party or a crowded place, most of the
Mm.
kids are sitting with the phone and they are
Yes,
fed with the phone.
it's a common
This is a very
scenario.
common.
Yeah,
You
very
know,
common.
I feel, I will feel really pity to go and tell parents, please don't use it. Don't show it. See, we used to bring up, or we have brought up by seeing the, moon and the sun and,
Yes,
the trees.
things around
That
us.
is missing.
Yes,
So
true.
again, coming back to your question of virtual autism, we need a difference here. See, though the symptoms are similar to the autism spectrum disorder, here also you have the speech delay, you do have the social delay. But once you understand that the virtual, once you reduce the gadgets or the exposure of gadgets,
Okay.
these symptoms can again, you can reduce the symptom. Otherwise, this also leads to a developmental delay.
So
That is
it'll
why
aggravate more.
we call it, yes, yes. So
Okay.
once you start reducing, immediately you can see a better changes. But if so, I see so many cases, so many I can say in my clinic, I have 200 plus kids who are only falling under the any form of
Uh-huh.
neurodevelopmental disorder.
Okay.
In that, I can say at least 40 to 50 percentage of cases with virtual autism.
Oh.
Because again, the same factors of, either both the parents are working and, if they have been taken care by nannies or, someone
Mm,
where they give the phone or they are busy and they are engaged in the phone. And, the nuclear family setup where the kids are not getting exposure to the normal life of the early intervention.
true.
This is all the reason where the developmental delay happens. But if a virtual autism is identified in the very early stage,
Uh-huh.
we can recover it. We can recover very easily. Once you start tapering the exposure,
Uh-huh.
we can recover with interventions. We can, immediately start with the speech therapy and the other developmental therapies. We can recover very easily.
Okay.
See what happens in a virtual autism, it's only one way communication.
Yes, it's
You
one
got
way.
it.
Child is not talking to
It's
anybody, just listening.
Yes, it's just listening. And what happens many times, what I see is when they come for the, diagnosis, they will say, no, 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 ma'am, the child sings all the rhymes. The child can
Yes.
say apple, banana,
Yes.
everything the child is able to say, A to apple, everything the child is
Mm-hmm.
able to say. But where the challenge comes is when you ask the child to say, Twinkle, twinkle, little star, it will not say. But randomly, the child will be telling. That is in the root memory because of lot of exposure. But as a parent, what we think, oh, child is saying. But when you say hi and bye, the child may not say. So these are the challenges in the virtual autism, which we have to identify and we have to report immediately to the pediatrician where they can guide us. Pediatrician and a developmental pediatrician. I always advise not only to visit a pediatrician, you should also visit a developmental pediatrician every 6 months once.
Okay. Coming to another question, which I really wanted to, I was waiting to ask, like autism is generally viewed as neuro disorder in our society. And unfortunately, we hear lots of people calling ASD child as mentally retarded. Now, my question to you is, if autism is really neuro disorder, then how come some extraordinary brains like Einstein, Newton, Tesla, they became one of the best intellectual brains we have ever known? So I really don't understand why we relate autism with neuro disorder, where we have such great
See,
examples in front of us.
see, it's